Thanks everyone for coming along on your weekend. I wanted to talk to you today a little bit about the challenges from the perspective of an NGO, a charity that's really trying to make a difference on the ground and actually try to improve the way it reports and understands its impact. When I listen to this discussions today, it makes me reflect on that kind of light bulb issue where there are some areas where it's quite easy to measure impact and change, and others where it simply is not. And I would encourage people to just think a little bit more broadly and maybe every now and then use a bit of instinct to think about where might be appropriate and valid places to donate. Because I think that there are a lot of areas that we probably haven't got right in terms of being able to measure the impact and show the impact. And sometimes these are really practical reasons. To give you an example, the Fred Hollows Foundation has been working in Pakistan for around about 15 years now. Now, we were able to really show the impact of some of the work we've done in the first 5 years, the rate of avoidable blindness in that country, actually over a period of about 7 years. The rate of avoidable blindness, so the rate of the percentage of people in the country who are blind, roughly halved over that time frame. Through the work of ourselves and two other charities working with the government there to really, really push a drive there. But since 2007, we haven't been able to go in and do another prevalence study in that country. It just hasn't been safe enough to do that. Right now, we're trying to do an impact study with some mixed data. We cannot even get someone into the country. So I think I'd really encourage you to be aware that there are challenges on the ground in actually making this happen in practice. And that is one of the reasons why there isn't perfect evidence out there right now. But at the end of the day, we still think we can have an impact and have a change. Anyway, that's my lecturing for today. So a little bit about evaluating practice. Just very quickly, a snapshot of what the Fred Hollows Foundation is, what we do. The Fred Hollows Foundation was set up 25 years ago. Professor Fred Hollows, very famous Australian, who really had a passion for making sure that eye health was available to everyone globally, affordably and easily. He saw a world where no one was needlessly blind, and Indigenous Australians also enjoy the same health as other Australians, so a real advocate for Indigenous health as well. So a few key facts: 32 million people in the world are blind, 4 out of 5 of them don't need to be, so it's avoidable or treatable, preventable. Most of the, more than half of the people who are blind due to cataract. And cataract is something that can be addressed with a 20-minute operation. We make it clear on our website and so on that $25 can restore sight. You can pay $25 to actually do that cataract surgery. And by 2020, we hope to eliminate avoidable blindness, although I would say quite a few challenges have come along the way, and I don't think we're going to make that challenge, but it was a nice goal when it was set up 10 years ago. So the box of fire wasn't happy either. I don't know what that is. So I'm showing you this for two reasons. One, to get a perspective on where we work, but also how we've been talking about our results for quite some time. So we are working right now in 26 countries around the world. We've got a physical sort of country office in 13 of those, and we use those to work across a total of 26 countries. These are the results from 2015. And if you look at them, they're very output focused, I'm going to say. So our global results talk about doing almost 900,000, supporting almost 900,000 eye operations, 8 million people treated for antibiotics to prevent trachoma, training doctors, etc., etc. So very output focused. And that partly comes from, I guess, a journey that we've been on as an organisation. We have been very, very focused on delivering activities and services on the ground, so partnering with organisations, training doctors and making sure those services just get delivered on the grounds, bringing in consumables and so on where we need to, etc. But things are changing a little bit, and I'm going to sort of take you on a bit of a journey that we've been on in the last few years that has changed the way that we work, and as a result is going to have to change the way that we measure and report on our impact. So a few years ago, I was a partner at PricewaterhouseCoopers, and I actually have one of the unusual people who went from working in a large consulting firm to working in an NGO, and I have no regrets about that choice. It's one of the best decisions of my life. And when I was working with PwC, I did some work for the Fred Hollows Foundation at the time, which was to actually look at the costs and benefits, an economic cost-benefit study of eliminating avoidable blindness. And one of the key things that came out of that piece of work, and I think that was most startling for the Fred Hollows Foundation, was just how much money was needed to end avoidable blindness, just how much investment would be needed to actually make that change. The cost-benefit study was excellent. It showed on a very, very conservative scale at least 4 times return on investment from making the investment to end avoidable blindness, but the reality was it's still a lot of money. So we were talking about something like sort of $397 billion globally. In costs, much of which 2/3 of that would be in already developed countries, but in developing countries, at least in total, $127 billion to end avoidable blindness by 2020. So that is a big number. Fred Hollows Foundation is around about a $70 million charity, so we're quite small. We're a drop in the ocean compared to that. Obviously, there's governments themselves who are contributing this, people, a whole bunch of other development actors and so on, but it was a big number, and I think it really made the organisation sit back and think, well, how can we actually do things differently to try to encourage this? So it became clear us delivering things on the ground wasn't going to be the only solution. So the result was a bit of a change in our strategy, and I know this is quite small and a little bit difficult to read, but if you look at the top 3 lines or top few lines, you'll see one there that's called our long-term outcomes. So the organisation really focused its energies on 5 long-term outcomes that we seek. 3 of those are very related to the key diseases that we see as priorities. So cataract is effectively managed. So we're not going to, what's the right words to say? Cataract is just going to continue to occur until the magic eye drop is created that might prevent it from occurring in the first place. So a health system needs to be able to set up to sustainably deliver cataract surgeries. Probably 80 to 90% of people in this room will need cataract surgery at some point in their life. It's just one of those things. So you need a system that's going to be sustainable to continue to deliver it. So our focus has really been on actually how do we work very closely with the governments to build a sustainable system to deliver this into the future. Trachoma is eliminated. Trachoma is an infection. It's a bit like, maybe it's like the deworming, I'm not sure, but it is something that it has the potential to be eliminated as a disease by 2020. A number of countries have eliminated that through a combination of better hygiene, sanitation, and also antibiotics. It's a real preventative health sort of measure. It's an intervention that is happening now on a grand scale. There's a real possibility that trachoma can be eliminated by 2020, and there are countries that are definitely on track to do that and get their signature from IFPB and the World Health Organisation that yes, they have eliminated trachoma. So that's a really positive story. But that's a different type of intervention. It's a real kind of get in and act sort of, roll out logistics. I'll call it a logistics process of getting people out to deliver antibiotics on the ground everywhere and get those good hygiene, sanitation messages out there. And of course, I mentioned that some things have changed that we probably hadn't predicted as an organisation some time ago, and that's diabetes. So most of the world's people with diabetes live now in lower middle income countries. If you have diabetes, there's a very good chance you'll go blind. So we've actually had to think about how we can work with the diabetes sector to ensure that they're integrating eye care into their model of care. So that's a big, potential tsunami that we're trying to stop before it becomes a major problem. And the last two are very much about how we work with systems, how we help to strengthen health systems to deliver this sustainably in the long term. So how do we ensure those systems that we work with are adequately resourced for the long term? Given that volume of money that an investment is going to need to be made, how do we make it easier for private investors to come in and work in this space? The social impact investing space, how do we make it easier? These are things that we're exploring right now. So how do we make sure that the health system is delivering these services efficiently, which is the key. If you can double the volume of surgeries output by a doctor by adding in 1 or 2 nurses into his team, it's a really valuable thing to do. So we're exploring those sorts of ways to make those services a lot more efficient. Okay, so that probably sounds really good and in principle. So how do we actually look at the impact of that? How do we actually report back to people in a way that can be synthesised and really understood? So one other thing I wanted to say as well before I go on in terms of the changing nature of our work, this area of global partnerships. And the diabetes example I gave you is a really good one where we are bringing what we do on the ground. So, we're working in 26 countries. We're bringing the knowledge from what we do on the ground into the global arena by working with some key global players. So, for example, the International Diabetes Federation, we're bringing the research and evidence from our on-the-ground programs to the International Diabetes Federation, who can influence diabetes providers all around the world. We're working with a global partnership for education because we're trying to integrate just some basic eye health education into schools. Obviously, if we can get children to become aware that they've got vision issues. I don't know if people have come across myopia recently, but if you look at China, there's some evidence that 80 to 90% of kids leaving high school need glasses. 80 to 90% of children leaving high school in urban China need glasses, which I find startling. So if we can get them to, be aware of that as soon as possible, get the glasses, there's evidence already that that's better for their education. So we're working with the education players, Global Partnership for Education, to actually put that into their system. Right, so a bit of a global suite. Again, how do we actually measure and report on the impact of all those sorts of things in a way that isn't just talking about our outputs, here's some services we delivered. How can we actually talk about the impact that we've had on blindness, which is what we're here to do? How can we actually synthesise all that? So Peter asked me last night, he was sort of looking at me confused, going, why does an actuary go from PwC to go and work? Is there something wrong? I'm like, no, something's different. Things are changing. The complexity of what we're doing is changing, and I think being able to talk about the impact in a way that's fair and appropriate is what we're trying to achieve. The challenges: how do we measure the impact of strengthening a health system? What does that even mean? How do we measure the impact of our advocacy, our global advocacy, and our partnerships? What do we really mean by a sustainable system, and how do we actually measure the impact? Last night I gave the example of even where we train a doctor, so that doctor might go and work for 30 years and do 700 surgeries a year. Do we count those surgeries for, the first year, the first 5 years, the first 10 years, the full 30 years they're going to work? I think these are all important questions that we need to be able to address. That fair attribution, and of course I've already talked about the challenge in Pakistan of even trying to get someone in there to look at the impact of the work that we've done. So a couple of solutions that we're exploring at the moment. This is still a work in progress, but we are getting there. We are sort of leading the sector as a whole. So there are there's probably about 4 or 5 really significant eye health charities globally. And through those charities and through the International Association for Prevention of Blindness, we are trying to standardise the way we talk about outcomes across the sector. There's been obviously discussions about looking at different peer-reviewed sort of publications and so on. When I look at some of those in details, I can see that there's very, very different ways that people are actually measuring and talking about the impact of what they do. And my example of we count things for 2 years, somebody else counts it for 5, whatever. That's just one example. So we are trying to come up with a standard set of outcome measures, not just outputs, but outcome measures that across the sector we are all using in a consistent way. And I think that will be a really valuable way to be able to sort of show our credibility to donors, hopefully, attract more to the sector. We're also looking at developing what we call like a blindness impact calculator. So, once we know what we've done for blindness, how can we translate that into something that's meaningful and can be comparable against other sorts of measures? So, if we can work out what our efforts have done for blindness, what does that mean for DALYs, life years saved, all those sorts of things, so we can compare ourselves better to other health measures. What does that mean for economic output? So there's a couple of examples already. I think Mari Stopes, I've got an example here, has done a great job of trying to do a similar sort of thing in the maternal and child health sector, or in the what's the right phrase? Contraception and so on, which I think has been really valuable. But that just sort of looks at the things we really can measure. There's a bunch of things that I think are going to be really difficult to measure, like if we strengthen the health system by improving the data collection, or training people in management, or these sorts of things. All these things that we know from a health system here are really good things to do, but it's a little bit difficult to actually measure the impact of those until we get really good evidence. So how can we actually sort of show progress against some of these things that are perhaps not so measurable? So we're looking at developing what we call a site readiness index, a little bit like a global peace index or something like that, that just sort of enables us to sort of highlight health systems that are stronger or weaker than others, and actually track progress on whether we've actually improved that health system. I won't talk about the outcome metrics, but I'll just give you that example that I showed before, which is Mari Stopes, who've done quite a bit to actually look at all the different interventions that they do. For example, it might be distributing condoms, it might be family planning, education, all those sorts of things. And they've developed sort of standard metrics just to say how that converts to, long-term outcomes. So how does all the different activities that they do, convert to pregnancies, unintended pregnancies prevented, or maternal deaths prevented, and so on. So I think that's a really valuable sort of measure, and we're looking at sort of, again, standardising across the sector so that we can talk about it in a fair way. And the index, I'm sure we've all seen different sorts of indices to measure complex things that probably aren't really something we can talk about impact just yet. So this is an example that I've seen recently with the Women's Resilience Index is one example. I'm sure we've seen the PIS Index and so on. So, looking at doing the same sort of things around system readiness. So it's a very sweeping overview of how we're trying to sort of strengthen the way that we measure and report on our impact and change, reflecting a change in the complexity and of the interventions that we're doing. So very happy to take any questions.